Hello, I just knocked on the door, closed the door to provide privacy for Tadia, performed hand hygiene or washed my hands, and I introduced myself. Tadia, my name is R.N. Hayes. Once I introduce myself, and before I do anything else, I want to perform 2 forms of identification. Usually it's on the arm, or I'll ask the patient either way. Now, I introduce myself, I ask, are you Tadia? She responds and tells me she's Tadia. Also, another form of identification, maybe her birth or social security, whatever you need. So today is her birthday. Okay, birthday, I found on her arm, I identified it, I have the right patient. 2, we're going to explain to Tadia today what we're going to do. Today we're going to do a breast examination. Now, me being a male, it's in my best interest and the patient's interest to ask, are you comfortable with me? If you're not comfortable, I can provide you another nurse to do the exam, or I can bring someone in the room to watch. Whatever you feel comfortable with. But make sure, if this is a patient you're not with or familiar with, especially for a male, you ask first. I asked Tadia, she said she's okay. We will proceed. Sometimes what some people like myself might do is still bring somebody in to observe just to keep everything kosher. So, my observer's there in the corner. Tadia said everything's fine. We're going to proceed with a breast examination. First thing we're going to do is we're going to inspect the breast and have Tadia sitting down. Right now she's sitting down. It's good enough. We'd have her raise her arm. So I can do a breast examination. I would support her arm as I do that. Normally, we would look into 4 quadrants. We do the upper outer, which is where most of cancer is at, which is around under the armpit. The lower outer, the lower inner. So this is the upper outer, the lower outer, the lower inner, and the upper outer. Now, once again, let me repeat, most cancer is found in the upper outer under the arm. So that's where we're going to do most of the palpitations to make sure we have a shot. If there is cancer, we would palpitate there. Now, while I'm doing my check, I'll be asking the patient, have you had any pains, lumps, rashes, swelling, trauma, discharge, surgery, history of breast disease, or medications? Now, I wouldn't ask her that all at once. I'd ask her over the course of while I'm palpitating. And while I'm palpitating, what I would do is I would use my 2 fingers. I would start about here, and here, to check for any tenderness, lumps, swelling, or rashes. I'm also using my fingers, but I'm also using my eyes to observe. While I'm doing that, I'm asking the patient any questions. At the same time, trying to get feedback from her. Once again, I'm a male. She might be she might be okay at first saying I can observe it, but if I see there's any discomfort, I can have the person that's observing behind me to come back in, and I say, hey, Tadia, I gotta go do something else. My assistant here is going to help you. Now, also, if I had an assistant or a colleague, they would introduce themselves as well. They would have washed their hands. They would have gone through that process and make sure that she knows who that person is. So we checked for tenderness, swelling, lumps. We did all our things here with the support of the arm. Next, we would do is probably have her lay down. Now, before I lay her down, let me put her back up. I'm also doing a general inspection of appearance, noting size and shape of the breast, making sure they're symmetrical, both breasts. I would look for any increase in size, any trauma or inflammation, or infections of late. Also, I'll be inspecting the skin, making sure it's smooth. Color is even, no redness, no bulging, dimpling, skin lesions, or focal vascular issues. Now, that being said, Tadia is not pregnant, but usually pregnant women have a fine vascular network that's visible, or pale striate or stretch marks if Tadia was pregnant. But I saw nothing there. Also, I saw no edema normally here, so that was fine. Also, once again, while I'm checking, I'll be checking for her nipples. I'll be checking for symmetricality, meaning they're kind of the same on both sides. I will check for any recent retracted nipples. I note any dry scaling, fissures, ulcerations, bleeding, or discharge in general. Now, also while I'm doing this, any signs, a sign of cancer would be while I'm feeling, if I felt something hard. Also while I'm feeling, I would see discharge for cancer. Like a benign cancer, I would feel like it's movable, elasticity, you could feel a lump, you could feel the tissue. Now, also what I would do is I would inspect the subclavicular and the infraclavian areas right here. Now that I've done all of that, we've done the inspection, I have this patient sit down, and I'm sorry, I should have said, since I'm a male, for any comfort, I make sure she would disrobe to about here, and I would have her probably partially disrobe as I did my inspection, have her cover up one breast, then we do another breast, depending on how the patient feels or how she's feeling, or if she's totally not comfortable with me. As I said before, I would switch out with my colleague here and let them finish the evaluation if she felt discomfort with me. Now, at this point, after I finish, I would go and wash my hands. Any equipment I might have used, I would wash those as well. Put everything away. I would document, and this is where I would do health promotion. Health promotion meaning I would encourage the patient to become familiar with the look and feel of their breast, so they can detect any changes or report anything promptly. Also, the best time for them to do this is the 4th to 7th day of their menstrual cycle. The best place to do it is in the shower, while they're washing, maybe with soap, so it won't feel so hard when they're pressing and they can palpitate. Also, I would tell them to do is as they're in the shower, they would do an S pattern. They would palpitate across the breast while under the shower. They can do that. I suggest to try to do it in an area where they feel comfortable with, alone by themselves, so they can feel. Or they can do it in the bed, laying on their side. S pattern. At this point, after I've finished my health promotion, I would ask the patient, do you have any more questions? Any more issues? Anything, any concerns related to what we just did? Did you understand everything we did? Do you want me to go over anything? Or do you would like for me to do a demonstration again? At this point, I have the patient say, I would say goodbye, clean my hands. Or I would clean the hands, I'm sorry. I would let the patient go. Thank you.